The technology is really tied to a technical procedure. We call it transnasal esophagoscopy, by putting a very thin scope through the nose and having the patient swallow this instrument so that it gives us the ability to look down here. And it takes 3 to 5 minutes to perform the examination. The numbers are staggering. They say that 22% of the American population has GERD and 18% have what's called silent reflux or atypical symptoms. These are symptoms that are not the traditional heartburn or regurgitation symptoms. These are the symptoms of chronic throat clearing, hoarseness, feeling like there's a lump in the throat, all of these airway symptoms, 18%. So we're talking about 40% of the population.
That's an epidemic.
It's an epidemic. Everybody has at one point eaten that fried food, greasy meal before they went to bed and suffered the consequences. Question is, how often does that happen? Think about how many people are self-treating their cough, taking cough drops every day. Tums, Rolaids, people walk around with these in their pocket. They're self-medicating, thinking they're taking care of their problem. Wrong. All they're doing is treating the symptoms. They're not treating the root cause of the reflux. Well, unfortunately, the fastest growing cancer in the United States is esophageal. It's increased 850% since 1975.
But the good news is that if it's caught early, this is completely preventable.
Completely curable. Completely curable. We can now go down with a brush during that procedure and take some cells and then analyze these cells looking at the DNA structure and be able to quantify the patient's risk as to whether or not that Barrett's is going to go on to develop into dysplasia and then cancer. So we're able to actually look at the cells, okay, of Barrett's and at the DNA.
Goodness gracious. That's
And tell a patient, based on your DNA, you're at little or no risk to develop cancer. See in a couple of years. But if the DNA said that you are at risk, you have these 4 biomarkers, or a few of the 4 biomarkers that we're looking at, your DNA is telling us that you're at risk. I'll see you in 6 months, and we'll look at it again. That's the only way to stop it.